Well, who is addressing the issue in a productive manner to engage him to change that behavior? So it's one thing to criticize, but it's also key to meeting men where they are. You can go to the faith community, hospitals and clinics, as well as educational institutions. And looking and thinking about labor and delivery units, trauma centers, drug treatment units, think about that magic moment. Think about that moment when that father's there right before and after birth. Think about the trauma center where someone's life almost flashed before their eyes and now they're thinking about making a change. Think about drug treatment where that moment of sanity comes and that individual says, I need to get some services right now. That's a unique opportunity in those settings for us to get our information to those providers so it gets to those clients. That's an opportunity for intervention that we don't take lightly. The challenges of recruiting men are not new. Trust versus mistrust, thinking outside the box, us prejudging them and them prejudging us, as well as journeying from the comfort zone. And one of the probably most difficult negative influence from their peers. These are some of the competing forces that we deal with in trying to engage low-income fathers. So we have a staff of approximately 7 individuals to provide services to over 200 fathers annually in Baltimore City. So that's one of the reasons, in case anyone wants to know later, why I have all these gray hairs at such a young age. That's just part of it, school stuff part. But we have to get connected with the individuals in the community. Probably half the staff of men's services actually came through the Fatherhood program and are doing other positive things in the community. So in some instances, they're already legends in the community through their past. Also, they've been viewed in their transition into a positive lifestyle, and that garners a lot of credibility with a lot of the individuals we work with in the community. And again, I talk about strategic tips for recruitment because, we don't wait for the men to come to us. We go into the communities, and if you look at the different things, it says assess the demographics within your state. And even in starting CFWD in 1999, and that's what Joe Jones did after several years of being successful at Healthy Start, he felt that taking the program out of Baltimore City government and actually making a community-based organization would provide more flexibility in meeting the needs of our diverse communities, which it did. And let me say this, you can do that with also still maintaining those positive relationships with government organizations and other organizations. Because one of the things we recognize is, hey, we're serving the same families, and we're pulling against each other. So even though we put the gloves on and we won a few battles, we lost a few battles, we were willing to talk about difficult issues such as family violence. We were willing to talk about issues such as marriage, co-parenting. We're willing to talk about issues such as child support arrears. And to be a progressive program, we'd be doing a disservice to our clients to not even become educated on those issues. So what's the end game? What are we looking for in providing these services in Baltimore City? And we're just an ink drop, but a necessary ink drop. We're looking to empower fathers. I don't have to mention the statistics over and over again, but the ideal is that if we can empower these fathers, they will invest in the children, the community and the family will become strengthened and will flourish. But there's some things that programs need to do, and I'm going to kind of close around this area. You need clearly defined mission. It has to be clear. Also, a lot of policy is data-driven. So a lot of times we hear our funders coming up and coming to do a site visit, we start to cringe a little bit. We have to be prepared to deal with that because that's the justification for the need of our services. $1,000 in arrears. We have fathers throughout the country who are abusing their children because they don't know how to deal with stress and anger and aggression in an appropriate manner. But I'm optimistic. With all that being said, I'm optimistic, and I have a staff of 7, which again is a small snapshot, but we are dedicated to the work that we do, and we believe that if we can sustain ourselves in these times, we can also advocate for policy that will make some of the faces that you saw on the screen have a better lifestyle. Thank you.
we're going to have the panel reassemble. We're going to have questions and answers from the floor. And there are 2 mics on the floor for anybody who has a question. And also, as we go through this, on your table, it should be a Leadership Organizations Philosophy Survey. Start looking through that. The next part of the discussion is on that, especially page 8, 9, and 12. Okay? And anybody who has a question, let's feel free to raise your hand for anybody on the panel. While you're deciding on your question, Dr. Gadsden, you have your mic.
I just want to do a quick PSA of the sort. One of the things, we have a number of resources at MCOF, but one of the things that you can get online is access to what we call the Fathers and Families database. It is a collection of some 9,500 articles and reports which we have abstracted so that they can be read by a diverse audience. They chronicle all the publications that have come out about fatherhood. So if you want access to that, the address is www.gnse.upenn.edu. That's www.ncoff, the National Center on Fathers and Families, .gse, Graduate School of Education, .upenn.edu. One of the things is on the...
It's in the packet.
It's in the packet. Okay, it's also... My access to the link, which also updates information that from around the country on a daily basis.
Okay. Any questions?
Yeah, it's in the packet.
It's in the packet.
GSE. It's in the packet. It's also on the table in the back. I just wanted to bring it to your attention.
Good morning. I wanted to thank the panel for the... Can you hear me?
Yes.
I want to thank the panel for their presentations this morning. I wanted to address this comment to Mr. Rice. Thank you for coming to Philadelphia. I know Joe Jones very well. Hope the company started many years in the past with him. I wanted to know where your funding is coming from to keep your program afloat.
We have a variety of funding sources: the Public Welfare Foundation, Charles Stewart Mott, Annie E. Casey, the Able Foundation in Baltimore City. Also, through the Partners for Fragile Families, it's a national demonstration that's winding down through Ford. But there's some federal matching dollars, I believe, through HHS to come with that. So primarily, the foundation community has been a support, but also we are developing a training capacity. We've done training for the District of Columbia around outreach to low-income fathers. There's also a marriage curriculum, co-parenting curriculums that will be out shortly, and that support is coming through the Ford Foundation and also from the TANF office in Louisiana.
I have a question about the role of women. Since the social work profession has primarily been women, there are men in the field who go out and see women who are on public assistance, who are in the child welfare system. But what is the role of the professional woman in working with fatherhood programs?
I guess I'm a woman, so I have the answer.
Well, experientially.
I'm just kidding. Well, they just started all giving me the microphone. I think there are multiple roles. I think we think a lot about social work. My colleague Jay Fagan at Temple, whom I think many of you know, has been working, he works with MCOF and a number of other people, Ronnie over there. Some of it may be working directly with families and mothers and talking through issues. But I think there's a more systemic issue that needs to be addressed, which has to do with the way in which social services are constructed and thought about to serve families and to ensure the best interest of the child. And one of the things that has been striking, and probably has been the one thing that has been most transformative for me in the past couple of years, is just becoming more immersed in the work that looks at the implications of parent incarceration on children. These kids are thrust into the child welfare system, and it's not clear how their issues are addressed, or what the thinking is that's going into figuring out what the role is. I think that since social workers are primarily women, I think as women and as social workers, they could take a lead in working through those issues, thinking more decisively about what the real problems are and making that happen. I mean, social workers often say, as I said in the talk, it's, we have to worry about some basic issues to keep women safe. And so it's an instructional issue. I think on the ground, women work in most of these fatherhood programs. Men work in women's programs. I think women can work in men's programs, even though I think that there's just such a gender issue in our society. So in many ways, the direct services, I think, are probably more effectively done by men. But I also can say, after having seen all these programs in different places around the country, that, let me back up. I think you have to figure out what the role is. Do you want it to be a direct service, or do you want to have a more organizational role in making the thing happen? If that's the role we can take, then we take that particular role, understanding that in much the same way that if I'm not Spanish speaking, I'm not going to be quite as effective talking to a Spanish speaking audience as a person who's a Spanish speaker, but figuring out how to make the organizations work. And certainly in the Bay Area, women were disproportionately running the programs on a day-to-day basis, and the men were actually, doing a lot of the direct encounters with the clients.